Hi everyone. Today we are going to discuss about how can we categorize the patient suffering with pneumonia, whether they need OP-based treatment or a hospitalized care based on the important CUP65 score. This score indicates the severity of illness in patients having pneumonia. Very simple to remember. C stands for confusion, U stands for urea more than 7 millimole per liter or more than 20 mg per deciliter. And R stands for respiratory rate, which will be more than 30 cycles per minute. B stands for blood pressure, that is systolic blood pressure less than 90 or diastolic blood pressure less than or equal to 60. This is indirectly saying the patient is in septic shock. And 65 indicates the age is more than 65. Here, each parameter will be given 1 point. So in a patient with pneumonia, if nothing of these are present, score becomes 0. So we can treat the patient on OP basis. That means we prescribe him some antibiotics, oral antibiotics, and he will be at home taking those medications. If the score is 1 or 2, the patient should be hospitalized unless the score is entirely or in part attributable to an age of more than 65 years. In these cases, hospitalization may not be necessary. So if the score is more than or equal to 3, the mortality rate will be very high, that is up to 22%. These patients require ICU admission. So there is another score called Pneumonia Severity Index. This has greater efficacy than CURB 65 score, but this is very difficult to calculate. This is based on the existing comorbid conditions, signs and symptoms of the patient, and both laboratory and radiographic findings. So based on this, prognosis can be assessed.